and welcome back to our ASCP practice series. Today we are stepping it up with more challenging questions that really dig into specific disease states, classifications, and diagnostic features. The first question is, a Gaucher cell is the best described as a macrophage with. So the correct answer is A. This is a classic description question. Gaucher cells are macrophages that are unable to break down a lipid called glucocerebrosidase due to an enzyme deficiency. This lipid accumulates into the cytoplasm, giving it a very distinct appearance that is often described as wrinkled tissue paper. Is which of the following suggests a diagnosis of Hodgkin's disease rather than other lymphoproliferative disorder? So the correct answer is D. Rich stem cells. It is the diagnostic cell for Hodgkin's lymphoma. These cells are large and typically have two nuclei, giving them a classic on-eye appearance. Finding these cells in lymph node biopsy is essential for diagnosis Hodgkin's disease. The question is, in a patient with fever of unknown origin, which of the following finding is not consistent with inflammatory process? The correct answer is B. Increased albumin level. During inflammation or infection, the liver changes its protein production. It starts making more of certain proteins called positive acute phase reactants. C-reactive protein, fibrinogen are classic positive acute phase reactants, so their levels increase. The increased fibrinogen causes RBC to clamp, which leads to increased ESR. However, the liver decreases its production of other proteins to conserve resources. These are called negative acute phase reactants. Albumin is the primary negative acute phase reactant. During inflammation, you would expect albumin levels to decrease or stay the same, not increase. An increased level of albumin is inconsistent with inflammation. Question. The presence of the chromosomal abnormality T5017 and a high incidence of disseminated intravascular coagulation DIC is diagnostic of. The correct answer is C. Acute promyelocytic leukemia FAB type M3. The translocation T5017 is the genetic hallmark of acute promyelocytic leukemia APL, which is FAB type M3. This translocation creates the PML-RORA fusion gene. The abnormal promyelocytes in APL are filled with granules that contain procoagulate material. When these cells die, they release these substances, triggering DIC, which is life-threatening medical emergency. The following statements does not correctly describe the WHO World Health Organization classification of hematopoietic neoplasms. So you need to choose B. Diagnosis is based on cellular morphology and cytochemistry. Because in this question, does not correctly describe. Actually, diagnostic criteria include morphologic, cytochemical, immunologic, cytogenetic, and molecular features, not only cellular morphology and cytochemistry. Last question. Which of the following would be least helpful in distinguishing chronic myelogenous leukemia CML from a neutrophilic leukemia reaction? The question asks what is least helpful. So, answer is A. An extreme leukocytosis with increased neutrophilic bands, metamyelocytes, and myelocytes. Both CML and a severe leukemia reaction can present very high WBC count and a left shift. The other options are key differentiation. Leukocyte alkaline phosphatase score lab score. This is the classic test. The blood score is low in CMA and high in leukemia reaction. Presence of MAC splenomegaly. MAC enlargement of the spleen is common in CML but rare in leukemia reaction. Neutrophy and endospores and Taussig granulation. These are signs of a reactive process and seen in a leukemia reaction but not in CML. I hope you learned something new. See you in the next video.